I'm not sure if you've heard yet, but it is the month of October, and it is actually Breast Cancer Awareness Month. My grandmother is a survivor, and I want to celebrate that, but I also want to bring awareness to the matter. There are many factors that affect your risk for breast cancer, and genetics definitely plays a role, and that's something that we can't control. But the food you eat, the drinks you drink, the kind of lifestyle you live also have an effect on your breast health as well as many other organs in your body. Now, as a busy mama of one and possibly multiple children, you feel like you don't have time to take a shower alone, much less take a day off to do a mammogram. But friends, let's just have a quick chat about that. Hey mama, welcome to Holistic Health for Moms. Do you want to lose weight and have more energy? Do you find yourself up late at night searching Google about hormones, weight loss, and how to get healthy? Do you wake up with big, ambitious goals only to feel overwhelmed and frustrated when the scale doesn't move and you look 5 months pregnant after eating again? Hey, I'm Jennifer. I'm a mom of 3, a conventional health nurse practitioner that also believes in natural and holistic health. I kept hearing my patients tell me that they were overwhelmed, tired, and couldn't lose weight. They were overwhelmed with all the health and weight loss information out there. It hurt my heart to see women who wanted answers and solutions to only be given prescriptions and vague directions like eat better and exercise. They needed to get out of the traditional healthcare box, and I wanted to help. So I created this podcast. In this podcast, you'll learn about optimizing your health and transforming your mindset. You'll learn about tools to help you build on what you know is right for you and reclaim the energy and health you know you should have. If this sounds like you, raise your hand and say present and accounted for, and let's get this party started. Now, I personally think that the providers I work with are amazing at raising awareness or, letting women know what their risks are, okay? However, that is in the allopathic realm. And unfortunately, some things are not recognized in the allopathic realm until like 10 years after it's been, discovered or reported. Okay, so we are exposed to environmental toxins every day. Some are in our control, most are not. But just because we cannot control the exposure doesn't mean we shouldn't at least know it puts us at increased risk. Okay? Exposure even from like a very early age, like things you could not control as a child. So breast cancer is caused by a combination of genetics, hormones, and environmental risk factors. Okay? If you have one or more first-degree relatives with a history of breast cancer, in particular ovarian cancer, uterine cancer, you're probably at higher risk for breast cancer. So it's definitely important to talk to your healthcare provider about your family history. Now, let's get to the 5 things the traditional healthcare providers probably will not talk about. First is exposure to endocrine disruptors. Now, what is this exactly? These are chemicals that can act like hormones, okay? Specifically like estrogen, okay? Now, some of these chemicals, like you may have heard of because a lot of the bigger companies are kind of jumping on the bandwagon and saying, phthalate-free, paraben-free, blah, 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 whatever free, but knowing that they done put something else in there that's just, just as bad probably. But anyway, that's neither here nor there. First thing is phthalates. Phthalates are actually chemicals that make plastic soft and flexible. They can also be found in personal care products, nail polish, hairspray, shampoo. Okay. Parabens, also, they're a type of preservative. They can be found in shampoos, moisturizers, lotions, makeups, shaving products. And these things can be absorbed through your skin. And once they're in your body, they can act like the hormone estrogen, which can put you at increased risk. Also, pesticides. This is why the EWG, or the Environmental Working Group, puts out a Clean 15 and a Dirty Dozen list. Because you don't have to buy all organic to, not, or to be, it's not 100% or it's not 100 or nothing. Okay. Gosh, I can't make words. It's not all or nothing. I'm sorry. So you don't have to buy 100% organic 100% of the time. But the EWG puts out this list and shares the highest concentration of pesticides in their Dirty Dozen, and then the least contaminated on the Clean 15. So it kind of gives you an idea of the things that you can focus more on if you do intend to buy organic to lessen your exposure to pesticides. Now, the next endocrine disruptor is per and polyfluoroalkyl substances, or PFAS. And these are known as the forever chemicals. Like, they never go away. They never disappear. These can be found in nonstick cookware, waterproof or wrinkle and stain resistant clothing, skincare products, especially ones that are labeled long lasting or waterproof. And y'all, it's been tugging at my heart for a long time to just stop using the mascara. Can I just tell you, I went to CVS the other day and the mascara that I used was $14. And I was just like, I'm going to have to roll with what God gave me. Anyway, I digress. So PFAS, think just like the clothes that you touch, that you wear all day, and the carpet or rug that you walk on. Like, these things can be absorbed through your skin. And at, high levels, if you're slathering on lotions every day and makeup every day and, wearing clothes every day that have these chemicals, like that adds up over time. Okay. So first is endocrine disruptors. Second, unhealthy weight. Y'all hear me talk about weight loss and whatnot all the time. And it's not just about aesthetics. It is about your health. Okay. Carrying excess weight is a risk factor for breast cancer. It puts you at increased risk because body fat can cause growth hormones to increase and tell the cells to divide more frequently. And this can increase the chance of cancer cells developing rapidly. And what makes this even worse, for those of you who are not in menopause or, perimenopausal or postmenopause, this is good to note. You want to be at a healthy weight prior to menopause, because after menopause, fat cells start to produce estrogen, and this obviously increases your risk of breast cancer also. Okay, so not just about aesthetics. Weight loss is not just about aesthetics. It is about your health. Okay, all around health, but right now, breast health. Number 3, your alcohol consumption. Again, we all know it's not good in general to have alcohol in excess on a regular basis. I mean, just empty calories, causes a lot of inflammation in the body. We don't really make smart choices if we have alcohol in excess. But specifically for breast health, alcohol changes how the body processes estrogen. So this can cause an increased amount of hormone in the body. And again, higher estrogen levels can put you at increased breast cancer risk. All right, number 4, lack of physical activity. Again, I'm going to say it. It's not about aesthetics. It is about your health. I'm all about looking good and feeling good, but also like being healthy from the inside out. Okay. Now, I'm not saying be physically active and do like a hardcore CrossFit like workout every single day. I'm just saying move more than you normally do and get your heart rate up several times a week. That can benefit you. Okay, studies have shown people who are physically active are at lower risk for breast cancer. So you have relatives, possibly like I do, that have a history of breast cancer. These are things that you have in your control that you can do to kind of, I'm not going to say cancel them out, but just lower your risk. Okay? Number 5, hormone therapy after menopause. Now, and I've talked to several women that are perimenopausal who are now also doing hormone replacement. There are many different combinations of hormone replacement therapy, many different ways you can take it. And I'm not going to go through all of those, but just please know that certain combinations can put you at increased risk for breast cancer. And so if you are on it, I would encourage you to ask your provider about, is this going to put me at increased risk? And just, see what they say. And if you're not at that stage of life yet where you need hormone replacement therapy, then this is just an FYI for you. So when you get to the hot flashes and can't sleep and the irritability, this will be in the back of your mind so that you know that this could possibly put you at increased risk, and just to educate you and for you to ask questions. And I'm not here to judge anyone, but it is my heartfelt belief that if you are a good healthcare provider, that you are more than willing to answer questions that patients have. Because we're not in that world where what the doctor says goes. We're in a world where people educate themselves and try to, ask questions and know what they're doing and knowing what these decisions are going to make for them. Knowing what these decisions are going to do for them. So, run through the top 5 real quick. Exposure to endocrine disruptors is 1. Unhealthy weight is 2. 3 is alcohol consumption. 4 is lack of physical activity. And 5 is hormone therapy, especially after menopause. So, if you have any questions, let me know. If not, and you are of age, make sure you get your mammogram. I do know that our local hospital gives out free certificates for a limited amount of certificates for free mammograms. And I think there are different, mobile units that go around. And there are places that also give discounts if you do not have insurance, or if you're financially not able to pay for it. But anyway, make sure you get your mammogram, do your regular breast exams, know you're normal. If you find something abnormal, please go see your healthcare provider. And I hope y'all have a fantastic week, and I cannot wait to talk to you soon. Bye. Okay, Mama, I hope you enjoyed today's episode. If so, would you take 30 seconds and subscribe to my email list? By signing up, you get my free meal planning template to help you start optimizing your health today. Also, if you could leave me a review, this helps this podcast rate, helps more sisters see it, and it lights me up to know this podcast is helping you. Okay, time to go make sure the clothes are washed, ball uniforms are ready, and snacks are prepared for this week full of games and chaos. I'll meet you back next week for another episode. Have a great week, sister.